Hey everybody, so this week we're talking about antibiotic stewardship. And antibiotic stewardship means the responsibility that we as healthcare workers have to judiciously and efficiently use antibiotics to treat infections, and also to educate the public on the proper use of antibiotics and the rise of drug-resistant infections. Working in the ER, I have been asked many times when discharging patients why they haven't received any antibiotics or even a prescription for antibiotics for their discharge diagnosis of some type of infection, like an upper respiratory infection or bronchitis or something of that nature. And I've had to do a lot of education when it comes to this about why that is the case and why they haven't received any of those. And I think a large part of it is because we live in such an immediate gratification world that we view antibiotics as kind of our immediate fix to what is making us feel bad. We think these antibiotics are going to immediately kill whatever it is that's making us sick. So instead of letting our body fight it off naturally, we want to feel better right now. And we think antibiotics are what is going to make that happen. We as healthcare providers have a responsibility to educate our patients and educate the public on the real role of antibiotics and how they are supposed to be used. Antibiotic stewardship is also very important in relation to the recent Ebola crisis and the drugs that are being developed to fight it. Our textbook states that microorganisms have the ability to replicate extremely quickly. And we've also learned from our text that the mutations that cause the antibiotic resistance are random, and there's really no way to predict those changes. So antibiotic stewardship in relation to the Ebola outbreak means that we're being very cautious and very careful about how we administer these medications to fight Ebola and who we are administering them to. And this is to decrease the chances of the Ebola virus being able to mutate and become resistant to these medications.